Hi, my name is Kim Cornelius, and I would like to respond to Shannell Cooper. Shannell did her video case study on acute respiratory distress syndrome on a patient named Mrs. G, 64-year-old female, that presented acutely at an outside hospital and was transferred into her facility at the University of Kentucky. So the impact on my nursing practice from Shannell's video would be that where I work in the OR, I need to be reminded of what floor nurses do. Our experiences are very different. Floor nurses they're pushing drugs, like they're at the bedside. They're doing many different things than what we're doing in the OR. You know, in the OR, people do present acutely, but it's for surgery. So it's a very different experience. I was really fascinated by her video and what she had to say. What other info would I need to know for the care of this patient? I feel like Shannell covered all the bases. I've made some notes here that I keep looking at. She had very little history to work with, no home medications. The patient was a non-smoker, non-drinker. The physical exam that she provided was very thorough. And then once she was actually at the facility at University of Kentucky, the given meds were listed, and this is something that I don't really have a lot of experience with. You know, in the operating room, the medications that are given by anesthesia. So it was interesting to listen to that and to listen to, you know, the different drugs that are given and why they're given, and she explained it very well. And the labs were included. This patient was obviously septic just from looking at the labs. You know, in the OR we do run blood gases all the time, so we do see that. And she tested positive for the flu, so this patient was obviously, she was septic according to her labs. What surprised me the most was how acutely ill this patient presented, with very little history, and the fact that she actually got better. Like, she was so sick and got better. You know, and Shannell pointed out like many different things, like the patient was acidotic, that you needed to be careful not to overload with fluids. Not only did she have the flu as an issue, but hypertension and AFib. And she included that they did procedures by the bedside when they put the chest tubes in. So I think that that's kind of cool, because we do that all the time in the operating room, and it's different because floor nurses don't get to see a lot of the stuff that we get to see in the OR, and then we don't, you know, and vice versa. We don't get to see a lot that they see. And I think that Shannell's message is very important, that the team came together and, you know, provided excellent care for this patient, and this patient got better. You know, it takes a multifaceted team to be able to collaborate and get these patients that are super sick, to get them well and to get them back home again. So I really enjoyed your post. I liked it so much, and Shannell, I would love for you to be my nurse anytime. Thanks.